So, recording in progress. I hope this does not matter anyone. So welcome to the webinar. We are today celebrating the World Food Safety Day, Prepare for the Unexpected. Slightly earlier than the Food Safety Day, which will be on June 7th, but this would be a very, very busy day. And we were afraid from the IDF perspective that no one will be available on June 7th. So we decided to inaugurate the Food Safety Week. And even for some countries, it's the Food Safety Month, which emphasize the importance of food safety along the food chain. Today's moderator is unfortunately not Aurélie Dubois, because her dedication to foodborne disease goes wider. She made a self-experimentation with norovirus, bad idea. So we are wishing Aurélie a very nice and swift recovery, but would like to thank all the jobs she has done in the back in order to organizing this webinar, compiling the slides, making sure that the three speakers will be present on time with slides presented. And for those who know my lack of seriousness when it comes to matching availability, that's a great deal from Aurélie. Thank you, Aurélie, for this. For the Zoom housekeeping, as said, the meeting is presently recorded. We will ask every one of you to mute your microphone in order to avoid back noise. Turn off the video in order to make sure that only the speakers can be seen. You will have the questions that can be typed in the chat box, and we will ask you your questions during the Q&A at the end of the three presentation. In case, of course, there are any hot burning questions that need to be addressed on the spot, but we will have a Q&A session at the end. We will have a master deck of the slides that will be available and shared for further distribution. So without further ado, the World Food Safety Day started some 5 years ago. It's June 7. It was initiated by the Codex Alimentarius. And every year there is a specific theme that goes around food safety and address to a variety of topics we are working on. Today, this year, is about preparing for the unexpected. Because food safety, as you know, is not a quiet journey. There is always a lot of surprises. And one of the key points that we need to address when it comes to food safety is preparedness. And preparedness comes in times of peace and not in times of war. So that's why you really need to be prepared for the unexpected, knowing that anything can happen in food safety. And this is what makes our life so enjoyable. Today's speakers will have a representative of at the SPCC Scientific Program Coordination of the IDF, Aditya Jain from India. So he's a Deputy General Manager and member of the National Dairy Development Board in India. You will have my colleague, Caroline Matthews, delegate of the United States, and she's part of the Laval. And myself, as you can get by the name and the way I'm speaking English, I'm French, delegate of France, also working with university in Italy, and I'm presently the chair of the Standing Committee on Microbial Hygiene. Today's program will first address the world of IDF within food safety, and that will be presented by Aditya. I will speak on resident antigen strain in the processing environment with the dairy perspective myself. And then Carolina will present one of the major work achieved by the IDF knowledge platforms of contaminants under responsibility of the SCRCC, which is the control of chlorine and hypochlorite residues in the dairy chain. And without further ado, I will stop sharing, stop speaking, and let Aditya present his slide. Aditya, the floor is yours. You are still on mute, Aditya. And there you go.
Hello and welcome everyone to this webinar to celebrate the World Food Safety Day 2024. My role today is to take you through the IDF world of world of IDF in food safety. So in this presentation, we'll briefly see about IDF, what it is, its working areas, how does it work, and what are its work outputs, importance of food safety for dairy sector, and what is the IDF's contribution to the same, IDF's engagement with international standard setting organizations for food safety, and how can one actually engage with IDF and contribute. So what is IDF? IDF is an non-governmental organization founded in 1903. So it's quite an old organization. Its current membership is 39 member countries, which represents 74% of the world's milk production. It draws 1,200 experts from different countries. It provides science-based evidence and advice for standard setting and regulation setting. It provides a forum for the global dairy sector to reach consensus on key dairy issues. And it also serves as a global voice for the dairy to intergovernmental organizations. So briefly speaking, the International Dairy Federation is a non-governmental organization that represents the entire dairy value chain at a global level. It is a recognized international authority in development of science-based standards for the dairy sector. And it plays an important role in establishing the right policies, standards, practices, and regulations to ensure that the world's dairy products are safe and sustainable. Its members are national dairy organizations. They are called national committees, and they represent the whole dairy chain in their member countries. Now, coming to IDF work areas, how does IDF work? So to understand how does IDF work, it focuses on 10 major work areas. And these are animal health and welfare, dairy science and technology, economics, marketing and policies, environment, farm management, food standards, hygiene and safety, methods of analysis and sampling, nutrition and health. So you will see that these are all encompassing when it comes to food safety and quality. And these 10 work areas, they result into 4 focus areas. And these are sustainability, nutrition and health, dairy safety and quality, and of course the standards that emanate from these areas. So these are called 4 pillars of IDF work. And to execute its work, it has got 15 standing committees. These standing committees provide a broad range of expertise and develop guidance. They develop joint standards with other organizations like ISO. They develop technical reports, and they also organize events. These committees also monitor the work of international organizations such as FAO, World Organization for Animal Health, Codex Alimentarius, and others. And they engage with them to ensure that the views from global dairy sector are appropriately presented and addressed at international fora. These committees they can be composed of any stakeholder in the dairy value chain. So they can be composed of farmers, manufacturers, scientists, regulators, academicians, nutritionists, marketers, governments, etc. And these are nominated by IDF national committees to the respective IDF committees so that the IDF's voice and the voice of its members is heard appropriately across the relevant and important fora. Now, when it comes to some of the topics that are not covered by any of these committees or areas, or if there are certain cross-cutting topics, IDF also establishes certain specific task forces which can then take care of such instances. Coming to the importance of food safety for the dairy sector, it is recognized that if it is not safe, it is not food. When it comes to food, this is what it goes, how it goes. All food is aimed for consumption, and it has to be then safe for consumption, meaning that when consumed, it should not result in any harm or injury to the consumer. Now, in the context of milk, it is a unique product when it comes to food safety. It is nutritious, highly nutritious, but it is also a very fragile product by nature when it comes to food safety. So, it requires careful handling, storage, and processing to be able to keep it safe. Several processes have been developed since the earliest days of humanity to keep it safe. And these are on the screen, you will see 2 examples of IDF publications. One of them is the technology of pasteurization and its effect on the microbiological and nutritional aspect of milk. And another one is on bioprotection. So pasteurization means making the milk safe through heat treatment, which is 72 degrees centigrade for 15 seconds. or 63 degrees centigrade for 30 minutes, or be it fermentation through which utilizes that principle of bioprotection to keep the milk and milk products safe and also extend their shelf life. Yogurt, cheeses, butter, and milk powder, and other similar products illustrate the strong food safety cultures where processes such as fermentation and heat treatment are involved. And these have developed over centuries to obtain a wide range of tasty, nutritious, and safe dairy products. So, understanding a little further, food safety is relevant for all stakeholders along the entire dairy value chain. It is the responsibility of each and everyone involved, including the consumer, as also to many national and international organizations. It has been a focus area of IDF since its creation in 1903. With many stakeholders involved across the dairy chain, IDF has access to key experts and the knowledge to share the best practices, develop standards, and consolidate and disseminate knowledge relevant to the dairy sector. On behalf of and for the dairy sector, IDF contributes to various means, such as standard setting by engaging with organizations such as Codex Alimentarius, VOA, or ISO, developing reports on dairy sector, including information on production, exports, policies, or burning issues, etc. Engaging with intergovernmental organizations that are relevant for dairy, publishing science-based research guidance, methodologies, and best practices. And for this, it draws from the best scientific literature and experts available to it. It also contributes by developing joint standards with ISO for the methods of analysis and sampling. And it also organizes and participates in the major relevant events and conferences. So to give you an idea, this slide shows what IDF did in last year, that is 23-24. It published 3 bulletins and 2 reports. It has organized 13 events and technical webinars. It has published 10 fact sheets. Fact sheets are actually compilation of the literature that provide you the current status of a burning issue, or the current status of some new concept that is to be floated, or simply about busting the myths that are related to dairy. Then it has also published 3 joint IDF ISO standard in the last year. It has made 42 contributions to international organizations, including IDF position on FAO report on integration of environment and nutrition of life cycle assessment of food items, which is a very important document published by FAO. IDF's position on supporting the nutritional need of children, again very important for all the nations, the important role of milk and dairy food full meal programs, and IDF submission to the Codex Alimentarius Commission on the scientific integrity of Codex. Again, a very important topic. IDF's contribution to food hygiene of milk and milk products. So from in general food safety with a specific emphasis on food hygiene on milk and milk products, IDF advocates a preventive approach for food safety in the dairy sector that starts with implementation of good hygienic practices at different points in the chain from farm to fork. And as we have seen, safety is one of the 4 pillars within IDF. IDF, thanks to its wide network of worldwide experts with various backgrounds and expertise, produces publications to share knowledge and best practices to mitigate risk along the dairy chain. It promotes good agricultural practices, good milking practices, good manufacturing, and good hygienic practices for transformation of raw milk to various milk products. Some of the examples are shown on this slide in this areas on IDF's contribution in this area. So these are ecology of Listeria species and Listeria monocytogenes. There's a publication in International Journal of Food Microbiology on Shiga toxin producing E. coli Aztec, as we call it. Then there's an inventory of microbial food cultures with safety demonstration in fermented food products. This is also a very important document because a user of these cultures then, if they are using a culture which is listed in this bulletin, they don't need to go on for demonstrating the safety of these cultures. Then you have more abstract bulletins like on heat treatment of milk, a revolution in food safety management through use of food safety matrix, and feed associated mycotoxins in dairy chain. So this is just to give you an idea what is IDF's contribution to food hygiene on milk and milk products, and also to food safety in general, as we have seen in the previous slide. Now, when it comes to standard setting, IDF also contributes to international food safety standard setting by working and engaging with Codex Alimentarius, International Standard Organization, and World Organization on Animal Health. When it comes to Codex, it has been engaged classically in development and publication of a standard on the use of dairy terms, on allergen labeling, food additives, methods of analysis, and more recently the guidelines for use and reuse of safe use and reuse of water, for the guidelines on prevention and control of Aztec in food. With ISO, it has a joint program for standards, specifically for methods of analysis for milk and milk products, on environmental issues, and on farming. So ISO and IDF, they publish joint standards in these areas. And with VOA, it works on terrestrial animal health code and also guides to prudent use of antimicrobials. So IDF and Codex actually have a very long-standing relationship. IDF came into being in 1903 and actually formed a precursor for Codex. Some of its documents, we'll see how they have formed basis for standards in Codex. Codex came into being in 1963 and they have had a formal relationship since then. IDF actually has been a catalyst of creation of Codex with its code of principle for milk and milk product that later evolved into the general standard on the use of dairy terms, the GSUDT as we call it. It has developed over 30 standards for dairy products such as butter, fermented milk, cheese, milk powder, dairy permeates, etc. by engaging with Codex. And the Codex committees that are relevant to it are milk and milk products, food hygiene, labeling, contaminants in food, food additives, and so forth. IDF has actually significantly contributed to the development of dairy commodity standards until the adjournment of the Committee on Milk and Milk Products. It supports the general standard on the use of dairy terms on the definition of milk. This is significant in view of the various different food products now coming into market and claiming superiority or claiming equivalence to milk, such as plant-based products. Milk is the normal, according to GSUDT, milk is the normal mammary secretion of milking animals obtained from one or more milkings without either addition to it or extraction from it, intended for consumption as liquid milk or for further processing. So this is how actually the other products that are in the market do not qualify as milk. And it is also interesting to note that no other group of food commodity has a similar kind of standard as GSUDT. And this also points to a unique nature of milk in human diet. IDF contribution to food hygiene of milk and milk products also includes certain codes of practices, and one of them was on the milk and milk products. In fact, it was IDF that developed Bulletin 123 on General Code of Hygienic Practices for Dairy Industry, and this code provided guidance to countries in issuing their own or establishing their own regulations for quite some time. And thereafter, this standard formed the basis for the Codex Code of Hygienic Practices for Milk and Milk Products, which was published later. IDF has also been involved in developing the guidelines for control of sugar toxin producing E. coli in raw beef, fresh leafy vegetables, raw milk and raw milk cheeses and sprouts. This is a recent contribution, an output of its engagement with Codex, and it was adopted in 2023. IDF has also been involved in revision of general principles of food hygiene and for principles and guidelines for the establishment and application of microbiological criteria related to foods. These are certain classical Codex documents and are widely in use across the world. Codex Code of Hygienic Practices for Low Moisture Food is another one, which was published in 2015, and IDF has directly or indirectly contributed to development of all these. More recently, IDF has also contributed to guidelines for the safe use and reuse of water in food production, for which a dairy annex has been developed. It has been cleared by the CCFH for adoption by the Commission in November. And IDF in this work had a unique opportunity to work with Codex because IDF acted as a co-lead in this work, which is quite rare in Codex for an observer organization. So a little more on the recent contribution of IDF, that is use and reuse of safe use and reuse of water. The aim of IDF's engagement was to ensure that the CCFH general guidelines and the specific annex for dairy in it are appropriate for the dairy sector. In addition to it, IDF will now develop guidance for the dairy sector that would complete CCFH work by providing indicators for hygiene as well as chemical quality, which will not be covered by CCFH work. The status of this work is as follows. The CCFH main guideline document has been published. IDF was a co-lead of the working group. And as I said, normally the non-governmental organization do not get to co-lead codex work, but IDF has a special status with codex as well because its IDF's recommendation are used as the foundation at step 2 of the codex for any milk related standards that are developed. The dairy annex to the main document of this codex text was drafted by the delegations of EU and Chile as well as IDF. It has been discussed in the last CCFH in Nairobi in March and has been recommended by the Committee for Adoption by CSE at step 5.8. Apart from it, there's a further development that this document will also have another annex which will provide guidance on water safety plans and technologies for ensuring the safety of water during reuse, and it will apply not only to dairy but all food products. IDF remains a co-chair in this work as well. And IDF complementary work will, of course, kick off shortly, whereby it will be developing indicators for hygiene as well as chemical quality on safe use and reuse of water. So how does IDF take care of the codex work? Within IDF working streams, they have several, as we saw, 15 standing committees with expertise in the field. And these standing committees, they follow the relevant codex committee according to their own expertise. For example, the standing committee, IDF standing committee on food additives will monitor and follow the codex committee on food additives. The IDF standing committee on microbial hygiene will follow and monitor the codex committee on food hygiene. The IDF standing committee on standards of identity and labeling, it follows and monitors the codex committee on food labeling. Similarly, the IDF standing committee on nutrition and health monitors the work on and contributes to the work of the Codex Committee on Nutrition and Foods for Special Dietary Uses. Recently, however, we have been observing that many cross-cutting, cross-disciplinary topics come which require coordination between expertise for different expertise. For example, probiotics and their labeling, food allergens and their labeling. And so IDF can draw from its committees and put in place small groups or task forces which then take care of these kinds of work requiring cross-cutting expertise. When it comes to IDF's contribution to food hygiene of milk and milk products through engagement with ISO, these are some examples that you see on the screen as a recent contribution of IDF. Milk and milk products, determination of alkaline phosphatase activity through fluorometric microplate method, which is used as a reference method to ensure that the milk has been properly pasteurized. Then you have guidelines for the validation of qualitative screening methods for detection of residues of veterinary drugs and milk products, which has a very strong and good usage when it comes to use of different methods for detection of residues of veterinary drugs across the world, and it aids in harmonization of these methods through validation. Then you have milk and milk powder, determination of aflatoxin M1 contact through cleanup immunology chromatography and determination through high performance liquid chromatography. So IDF and ISO actually collaborate since 1963 at the request of Codex Alimentarius, and they have developed a program whereby they produce joint ISO IDF standards for milk and milk products, specifically for analysis, environment, and farming related aspects. To this date, around 189 joint standards have been published, a number of them relevant to food safety, and about 60 of them have been referred in codex for the methods of analysis for different milk and milk products. And these are certain other examples just for you to gain the width, and the breadth of the topics that are covered by these standards. For example, it ranges from detection of Enterobacter sakazaki for enumeration of pseudomonas, for determination of nitrate content, for enumeration of contaminating microorganisms through colony count technique, which is a classic technique for microbiological analysis. And then there are many, as we saw, 189 have been already put in place as joint standards. So now when it comes to engaging with IDF and contributing to the work of IDF, if you become engaged with IDF, you get an opportunity to become a part of global network of the best in the dairy sector. You get a chance to impact the way the global sector progresses. You grow in your career as well as mentor others and be recognized in the dairy fraternity at international level. So it's basically a learn and contribute kind of system where what you have is a win-win position. And for getting to engage with IDF, you need to get in touch with your national committee that represents IDF in your country. So with this, I think this is briefly how IDF contributes to food safety. And with this, I would like to thank all of you for attending this webinar and for patiently hearing this presentation. Thank you.
Thank you, Aditya. So if you have any questions, please do not hesitate to put them in the chat. Keep them for the end. We will try, for the sake of time, to have the question at the end and be sure that everyone gets the presentation within the hour. Most of the IDF publications that you have seen and have been explained by Aditya, you find them on the IDF websites, and you have the link of the collection of publication provided by Annabelle in the chat. So now I'm switching my hats from moderator to speaker, and I will discuss right now about resident and transient strain in the processing environment, providing you the dairy perspective. Processing environment monitoring is something very hot and debated right now within the food safety field. We have two buzzwords, I might say right now. One is food safety culture, the other one is processing environments. Why? Because there are more and more evidence, in fact, that the processing environment in food factory is not sterile, which we know already, but we see also that some strains have the capacity to maintain their presence over years, over decades in the same processing environment. So that's something which is known for quite a while for the food industry by learning, by doing, with not further a lot of science behind. And following recent outbreaks with the use of whole genome sequencing, and we have seen among the years that the same strain was present in the factories, it was interest from food safety authorities. And presently, there is this recent publication from the Food Safety Authority in Europe, where they have tried to understand why there is persistence of microbial hazards in food and feed production and processing environments. We have three different examples we had recently in Europe. One was in France in 2017 with a Salmonella agona strain that was found again in 2017 and was the same strain causing the first outbreaks in 2005. We had another one in Spain with Salmonella puna, and the strain found in 2019 was the same as 2010. And we recently had an outbreak that lasted in Scandinavia, not related to dairy product, but to smoked salmons, that lasted over 5-6 years with the same strain, which was found in a processing environment. Then it raised the questions, why do these strains have the capacity to persist in the environment? One of the first ideas we had when we discovered these topics was to say that they have the capacity, they are developing specific properties that make them able to stay in the environment. Well, not exactly. In fact, what was identified in the recent EFSA report is that the main risk factor for persistence of strain in the environment comes from the poor hygienic design of equipment and machines, which sounds quite evident if you do not have a state-of-the-art facility where you will have issues at some points. So that's important really to have good equipment, meaning equipment is well designed, but also easy to clean. They identified as major factors that leads to persistence of strain in the environment, inadequate zoning and hygiene barriers. And that's another issue because we have this definition of hygienic zoning in the Codex Alimentarius, but when you go to food safety management schemes standards like BRC, IFS, or FSSC 22000, BRC is providing a good set of what is expected zoning. IFS is more vague, that you need adequate zoning and do what you want with it. So it's important to have in mind that the facility must be designed in order to avoid contamination, and then you need to address which hazard you want to mitigate. Either it's a microbial hazard, but can be also allergen hazards. There is inadequate cleaning and disinfection of the facilities. Often when you go to facilities, you hear that when you clean, you do not work. Well, when you clean, you do not produce, but cleaning and disinfection is part of the work. Because if you do not work in a clean setting, well, you cannot do a clean job. So it's important to have a good emphasis and spend the needed time of cleaning, and just not having 15 minutes to clean at the end of the shift, because that's what you have. If it takes 2 hours to clean, you have to find these 2 hours. I know it's easier said than done, but it's important to have in mind, if you do not clean, at some points, you will see the issue. Another one is the introduction of the hazards through raw materials. Not every raw materials can be heat treated or have a debacterialization step. So it's important to have a good mitigation of the raw materials, which are the critical ones. And that's what you find in all the guidelines on HACCP, when they mention that if you have a raw materials and you have to live with a potential contamination, you need to consider this as a critical raw materials. And the last one is humidity that can favor persistence. And that's one of the key words you must have in mind when you go to the facilities. You've got 2 enemies, gravity and water. So beware of the roof leaks and make sure that you don't have too much water. And that's something in the Code of Hygienic Practice that was presented by Aditya in the Code of Hygienic Practice for low moisture food. So that's the only codex guideline where you will see the distinction between dry cleaning, controlled wet cleaning, and wet cleaning. And often one of the issue you have that you do not have the appropriate type of cleaning in the processing zone. When you're dealing with milk powders, for example, one should focus on dry cleaning or eventually controlled wet cleaning, but not wet cleaning. And sometimes we had issue with salmonella contamination of the finished product. And one of the aggravation factor that was identified was the inappropriate use of water inside the premises. So it's important to have this in mind. And that's one also of the focus of the EFSA reports. In terms of processing environments, we have been working also some IDF delegates, not through IDF, but with ILC Europe. But Hélène and myself were part of this working group, and we are part of the IDF working group to provide the IDF bulletin. But we started with a publication in IGFM about this, about looking for the right microorganisms. And this publication is cited in the EFSA reports. One of the highlights to have in mind, why should we focus on the processing environment? First is that finished product testing is of limited interest in case of low prevalence contamination. If you have a very low rate of default, you will not find this by finished product testing. And that's something that most of the time operation people do not get. It's not because I test that there is nothing. And we changed the wording in the ISO since 2009 from absence, presence to detected, not detected. First, because the methods might not detect, but also because there might be anything to detect in the sample you receive does not mean that there is nothing in the global batch. If you go fishing to the lake and you don't catch any fish, don't conclude too fast that the lake is empty. Maybe if you take more time fishing, you will find a fish at some point. That's the same with pathogen monitoring. When it comes to understanding the relevance of processing environment, we have 2 concepts that can be used. One is the ICMSF equation. So ICMSF is the International Commission of Microbial Specifications in Food. So that's another observer at the Codex Alimentarius. ICMSF was created 60 years ago in order to provide guidelines or microbiological criteria for the Codex Alimentarius. And the observer at the Codex are sitting by the rank of order alphabetical. And as you can see, ICMSF, IDF, usually they're just on our left. So we have good collaboration with these people. And they try to concept to have a concept with an equation considering the prevalence minus the reduction plus the capacity of increase, growth, or contamination must be below the food safety objectives. And when we focus on processing environment monitoring, we focus on the C, on the contamination that can occur after the heat treatment. And that's something that you have embedded in the EU regulation, if you are working with ready-to-eat foods, whether they are heat-treated or not, there is a risk of contamination from the environment, which means on the application point for dairy, you might want to have pasteurized milk in order to get rid of the initial contamination you might have eventually have in your raw milk. But per se, if you do not work in a safe environment, you will find listeria at some point. Not the same, another one, but your environment is also a potential source of contamination. So, and this is why it's important to make this distinction between finished product testing on one side and processing environment testing on the other one. The US dairy industry also has worked on a global document, very interesting one, on controlling pathogens in dairy. They issued recently the version 2, which was for as a almost Christmas gift, I must say, for 2023. And they have a different concept. It's mitigated fully on pathogens. And as you can see, they understand that they propose that in order to have effective pathogen control, you have 5 key points of focus. And as you can see, the last one is the environmental pathogen monitoring. It is important in this equation to understand that there is this distinction between cleaning and sanitation procedures and control, cleaning monitoring, and processing environment monitoring. Both are linked. Both must be done conjointly. They also can be done with the same techniques and the same methods. The timing of sampling will be different, but it's important to have in mind when I'm making my sampling in the factory, depending on the timing, it's cleaning monitoring or it's processing environment monitoring. So it's very near, but not exactly the same. Confusion can arise. 20 years ago, the ICMSF proposed the proximity approach. They proposed to make a distinction between food contact and non-food contact surface. That's the wording of the codex. And in this approach to distinct different type of non-food contact surfaces, what the US mentioned zone 1 and zone 2, what we propose in the fact sheets from the IDF, either line or environment E1, which is food contact or non-food contact on one side. You've got E2 or zone 3, which is per se equipment far from the product, but still part of the processing environment. And zone 4 or E3 is outside the processing environment. It's important to use this proximity approach because at some point, if you search, you will find. But depending where you find, depending on the proximity, you will have different ways of reacting and not necessarily panic straight away. We propose to distinguish different types of sampling points. Some sampling points can be defined as part of the routine. They are always the same. We have to be careful that if you always take the same points and they are not relevant, you might end up with a false sense of security. Nevertheless, once you define routing points, let's mention the guardians, it's possible to define, to make a trend analysis, to have a clear objective, and to really focus and make sure everything is under control. Now, in order not to fall under complacency and avoiding looking where it hurts, it's important to have some investigation samples, the scouts. That's something that you often find in US-based guidelines when they mention you need to search and destroy. This is very important. Whether you want it or not, at some points, these environmental bugs can enter the premises. So it's better to search for them and destroy the arborage niche before they reach the product, which means that it's normal to find, and it's not necessarily that satisfactory if you don't find anything. But you have to make a distinction. Finding the pathogen of concern with the scouts, that's good work. Finding pathogens of concern with the routine points, there might be an issue ongoing. Now, for the microorganism of concern, it's important to understand which are the pathogens of concern and which are the hygiene indicators. Historically, when we speak in dairy of hygiene indicator, we mention coliforms. But that's, let's say, the old indicator. Now it's more important when you can to focus on Enterobacteriaceae. It's not possible in every dairy processing environment. If you're working with soft type cheese, sometimes we do use specific species of Enterobacteriaceae as starters. So as such, we need to maintain coliforms as hygienic indicators in these environments. But for the rest, in milk powders, in soft type cheese environment, we are not using alpha-alveoli, so Enterobacteriaceae should be the standard. And Enterobacteriaceae does not provide direct correlation with the presence of either Salmonella in low moisture food or Chronobacter for phase 1 formulation. That's very important. It's mentioned in the EU regulations in an addendum in 2007. That was one of the mistakes of a major foodborne producer in the US recently, where he only focused on EB and not on Chronobacter and Salmonella. There is a distinction between hygiene indicators, Enterobacteriaceae, and pathogen of concern, Salmonella or Chronobacter. So one does not replace the other. And this is, and why? Because resistant strain, they always have very low prevalence, they are in specific points, so you will not find them through routine hygiene monitoring of Enterobacteriaceae. So you need to maintain both. Another urban legend we want to destroy, and we mentioned this already in the IDF bulletin in 2019 on Listeria spp and Listeria monocytogenes in dairy. Enterobacteriaceae is not an indicator of Listeria. The only indicator of Listeria monocytogenes is the global genus, Listeria spp. That's why it's important in the choice of the standard, in the choice of the method you are using, to have both Listeria spp and Listeria monocytogenes. If you find Listeria spp and it's not a monocytogenes isolate, good news, you don't have a food safety issue yet, but you will have one. Because if you have Listeria spp in your environment, it means it's fit for purpose for the genus, and the pathogen species can enter at some point. That's why it's important to look at the global genus. And if you find SPP but non-monocytogenes, you still have time to react. And it's important to react because we have examples of facilities who had Listeria spp but inocua and they were not concerned. And 6 months after, they have monocytogenes and it ends up in a foodborne outbreak. So it's important to react accordingly. So as said, this is detailed in the IDF Listeria bulletin in page 26 out of 52. Good news, I provide you the number of the page. You don't need to go through the 52 pages, but if you want, that's perfect. And the IDF Listeria bulletin is free of charge and available on the IDF website. Now, when it comes to processing environment samplings, what we need to consider as threats, and that was also explained in the IFSA report, you need to consider the microorganism of concern. You need to consider if you do have arborage niche. It's important to consider the water activity, which means am I using water or not, and organic matter present, even from the raw materials or from spillage during the process. You've got some control measures in action. One is hygienic zoning to avoid the entry of the pathogen of concern in the facility. Hygienic design is a good way also to avoid arborage niche. Appropriate cleaning, dry, control wet, or wet is a way to avoid the abuse of water, not only for a sustainability point, but also for the safety points. And also, if you do not feed the microorganisms, they will not grow. So you must hunt for the leaks. If you have any powder spilling during the process, it's important to get rid as fast as possible and not at the end of the shift necessarily. So when you compile, you see that for the risk, there is always a control measures possible in place, and which means that when you want to swab, apart from the proximity classification that you do after, you must have in mind when you look inside the premises, is it well designed in terms of hygienic dosing? Do I see that in terms of design, there could be a niche? Is there any water present, any leakage? And when you start to have 3 of the 4, even the 4, that's a good swabbing point, because it means that I might find it there. And that's why it's important to focus on this type of approach when you want to have in mind which type of swabbing points you need to do. And what I present you today is something that will be further discussed and elaborated on an applied example in low moisture food in milk powder by my colleague Ellen Vemenhoff from Denmark. And we are presently working on, we have an action team within SCMH, which is working on an IDF bulletin, which will compile the data you found today, the different guidelines available, and we want to end up in something practical, applicable for the food industry. One of the issues we find with most of the guidelines is that they either propose a proximity approach, propose the methods for swabbing, but that does not tell you where you swab. So as you can see, I'm not a graphic designer. I have, for the moment, only one green and one red box. I hope to find someone that can make it more visible for everyone. But it's important to have in mind what's the mindset when you need to go for the swabbing. First, focus on risk-based sampling when it makes sense. It has been addressed by the EFSA as critical sampling points. And then you can look at the proximity, make the classification, the trend analysis. But first, it's an investment. It takes time. It can have huge implication in terms of business contingency. So it's important to have the right swabbing in place. Thank you for this. And now I will hand over to Carolina for the platform knowledge.
Thank you, Francois. Let's work on sharing this. Perfect. So thank you very much for the introduction and for the previous presenter.
Not sharing it.
I'm not sharing it?
No.
Okay. Give me 1 second. Share screen share.
No, you do. Thank you.
Now I do. Perfect. Okay. Alrighty. Well, good. Well, thank you everyone for attending this webinar. As Francois said at the very beginning, my name is Carolina Mateus. I am R&D Director for DeLaval. I work also as one of the leaders for the IDF action team on proactive management of residues for cleaners, disinfectants, and anti-dip agents. And so today I'm going to talk to you about the control of chlorine and hypochlorite residues in the dairy chain in the context of the IDF knowledge platform on chemical contaminants. I will work on covering the IDF knowledge platform, how it came to be, and a little bit of background on it. I'll talk a little bit about the different places where we use chlorinated products in the dairy chain. I will highlight some of the main residues, talk a little bit about the regulatory framework that is present in different places, and then give you some recommendations that came out of this work. So, going to the knowledge platform, the objective of the platform was to build a topical guidance on the proactive management of chemical contaminants in the dairy chain, and to do that by creating a central IDF depository. So the work started in 2019. Is performed by the action team under the Central Committee of Residues and Chemical Contaminants. We have other IDF standing committees involved, so farm management, analytical methods for additives and contaminants, dairy science and technology, microbiological hygiene. We also have, of course, then for this, dedicated working groups, so international experts, coordinators per topic, background documentation, and so on. So to try to decide which topics we're going to work on, we started with a questionnaire for prioritizing the topics. So one of the first topics that was published was on chlorate. The bulletin was published in October of last year. The fact sheet I know is available on the IDF website, and Karen from Switzerland was the person that led this project. I didn't see her in the attendees today, but nonetheless. I'm going to spend some time talking about the second one of these topics that we are in the process of publishing. We expect it to be published this summer. It is on chlorine and hypochlorite residues. I see a lot of people that were part of this committee with me. So we have Harry and Alan. I know Alan was in the people that connected today. Bernadette, Hein, Francois also participated on it. We have other topics that are being in progress. So microplastics is being finalized. PFAS, the briefing sheet is finalized. And I know Ruben, and I believe he's attending, is leading this project. And we're in the process to starting one on organic acids. So the output, as I mentioned, we have briefing sheets, which are internal documents for IDF. We have publications in the IDF bulletin. And we also have fact sheets. The publications, then, we decided that they were going to cover the same areas whenever possible. So we'll have a chemical description, a description of toxicology, where we find the product in the dairy chain or the contaminant in the dairy chain, the regulatory environment, any analytical methods, and any mitigation measures that may be available. And then also, like the fact sheets that I mentioned, is just a summary, and it's available for free, and it accompanies each of the bulletins. So the intended use of the output is to be prepared when contaminants are linked to dairy, to mitigate the risk and to increase our knowledge and understanding of potential control measures, and to harmonize that and the approach of the dairy industry. So as you can see, let me see if I can get my pointer. Yeah, so as you can see on this graph, the idea here is that, of course, we cannot treat every contaminant the same. So we may have contaminants that can be controlled by the dairy industry, that cannot, or that can be controlled by the dairy industry. And we can have contaminants that are specific to the dairy industry, or some that are not specific to the dairy industry. So for the contaminants, for example, that are not specific to the dairy industry and where we cannot exert a lot of control, then the concentration, the focus will be on understanding. Whereas some contaminants that are fairly specific or very close to the dairy industry, or that can be controlled by us, so for example, detergents and disinfectants that we use in the dairy industry, then the focus will be on the control measures. Okay, so let's talk a little bit about chlorinated products in the dairy chain. The first thing is that chlorinated products touch the dairy chain both through intentional and unintentional means. And what I mean by that is that there are products that we're adding intentionally, for example, cleaners, and there are products that are coming in intentionally to us. So for example, fertilizers in feed can be something that we can say, okay, this is unintentionally coming to us. But the use of chlorinated products in tea dips, or the use of chlorinated products for cleaning and sanitizing the milking equipment, or the milking lines, or the tankers for transport, or the processing equipment, that is a more intentional introduction of the chlorinated products onto the equipment. Another intentional, for example, is the use of chlorinated water to dilute the cleaning and sanitation products, or for use, or when we use the chlorinated water to make brine solutions for cheese making. So a little bit on the different disinfection agents and where we use them, and then what may be the residues or derivatives that we find for them. So chlorhexidine is a very common active ingredient for tea dips. Chlorine dioxide, for example, can be used both as an active for tea dips, but also as a hard surface sanitizer, and also an environmental sanitizer. In the case of chlorhexidine, then it doesn't break down. The residue that we're looking for is chlorhexidine, but in the case of chlorine dioxide, we're looking to chlorides or chlorates. Hypochlorous acid is also particularly recent being used as a hard surface sanitizer. I haven't seen it yet as a tea dip. Residues, chloride and chlorate are common. Chloromethanes can be, cyanurate may be, depending on the way the hypochlorous acid is produced, the way that it's derived. Sodium hypochlorite, of course, we're all familiar with it. We can see it when we use it in chlorinated detergents. It can also be used as a hard surface disinfectant. It can be used as a sanitizer for the towels that are used to wipe the teeth of the animal. And we can have chlorates, perchlorates, and haloacetates as the main residues. So let's talk a little bit about the main residues and why they may be of concern, and then what are the real implications, because it may be the fact that it's present may not necessarily mean that it is an issue. So for example, chlorhexidine. So what is the concern? The concern is that chlorhexidine bioaccumulates. The concern is that it's persistent on surfaces, including the skin. However, absorption is negligible for it. So under normal use concentrations, and this is very important, under normal use concentrations, it is non-toxic. However, if we do have residues, then it may negatively impact starter cultures on fermented dairy products. So here, the use you will see that will come up when we talk about mitigation strategies. The appropriate use of the products is paramount here. Chloride, there's really not a concern. It's very reactive. It doesn't bioaccumulate. Chlorides in water may move into groundwater. And when they then react with soil and sediments, so it just may reduce the amount of chloride that actually reaches the groundwater. And then neither chloride nor chlorine dioxide, which is one of the sources of the chloride, build up in the food chain. Chlorate and perchlorate, so they're associated with inhibition of iodine uptake in humans. They're highly persistent in the environment, so that's where the concern comes in. However, they do not bioaccumulate. The entry into the dairy chain may be dependent on storage practices of the chlorinated detergents. So if we store these bleach solutions under in the presence of heat or for longer periods of time or in the presence of sunlight, then you're generating more chlorates. And so appropriate storage of those chlorinated or chloralkaline solutions is very important. And then also effective rinsing of the surfaces that are used to, where these products were used to clean or sanitize the surface. The nice thing is that the effects of chloride are reversible. Also, yeah. Okay, then if we move to trichloromethanes, so they're volatiles, and the concern here is that they accumulate in fat-rich products, of which we have plenty of dairy products that are fat-rich products. However, exposure to low concentrations, and these are low concentrations, even over time, does not pose a significant risk. When we talk about trichloromethanes, there is an acceptable daily intake of 10 micrograms per kilogram of body weight. Entering to the dairy chain depends mostly on the reuse of clean solutions and inappropriate dairy practices. So we know that water is scarce, particularly in some areas of the globe more than in others. And that total cost of ownership for milk processing facilities or dairies becomes very important. And so they're looking at ways of saving costs, saving energy, and saving water is one of those ways. And so some of the things that are being done is that it's reusing of clean solutions, say final rinse of the solutions like that can be used for a pre-rinse step. But reuse of those solutions when they contain chlorine products in them, hypochlorite, for example, can increase the amount of chlorates, perchlorates, or TCM present. The next one that I want to talk about is cyanurate, and really there is not a concern. It is readily and quantitatively eliminated from the body unchanged. Where is the concern coming from? So cyanurate is the salt of cyanuric acid, and it may be formed through the dechlorination of sodium dichloroisocyanurate, which is one of the raw materials that can be used to form hypochlorous acid. It's not the only way to form hypochlorous acid, but it's one of the ways to form hypochlorous acid. The next one is haloacetates, and so here the concern again is that they accumulate on fat-rich products. Dichloroacetate is metabolized in the liver to toxic metabolites, so that's where we're concerned. However, the risk is low in acute doses. And then in the case, for example, of trichloroacetate, there's little evidence of toxicity. So then the haloacetates are the result of the reaction of chlorinated disinfectants and detergents with organic matter during cleaning and disinfection of the equipment, or by use of chlorinated water in the production of branding solutions used in cheese making process, which is an issue because, like I said, they accumulate in fat-rich products. However, these products are mostly present in their salt form at and so then the acid form is only present. The acid form, which is the one that is associated with drinking water and with many foods, that doesn't pose an issue for us. Let's see. Yes. So that's what I mentioned here, that is present mostly exclusively in the acid form, not at the pH levels in dairy foods, so not as acids. So then here, I want to talk a little bit about the regulatory framework. And the main thing that I want to say is that it is not very even. There are some countries or groups of countries, the European Union, that have many details and regulation on different residues, and many other places that do not even mention any limits, or when they do mention limits, they do just reference either European Union or US standards. So some general remarks for the European Union. Active substances are evaluated for food safety and efficacy before they're allowed to be sold in the European Union. And risk assessment for human health and the environment is done by the biosolids product registration. So then some specific limits, the European Union identifies specific limits for TCM, for chlorate, for perchlorate, and for haloacetic acid. Most of it is in drinking water. Very little of the limits they do in milk. Although there are some specific countries that mention some things. So for example, for TCM, the maximum in drinking water is 100 micrograms per kilogram. The median in milk that we know is not a regulatory limit, but that has been found through studies in the Netherlands, is just 1 microgram per kilogram. The ADI is 10 micrograms per kilogram of body weight. For chlorate, there's actually a maximum residue limit that is established for milk of 100 micrograms per kilogram. The drinking water limit is very different, 250 micrograms per liter. But then there are different levels that are applied for disinfections methods. However, for example, chlorate is no longer approved as a pesticide in Europe. Again, perchlorate, then the situation is different. The ML4 infant formula is 10 micrograms per kilogram. This is infant formula, so we need to be very careful. And for perchlorate, there is drinking water legislation that is available that sets some values for chlorate, chloride, and haloacetic acid. So for example, for haloacetic acid, we know that the drinking water limit is 60 micrograms per liter, and it is a sum of the 5 different representative substances, so mono, dichloro, trichloro, and mono and dibromo acetic acid. In the US, then, the situation is completely different. So we have many bodies here that are intervening in the regulation. We know that sanitizers and disinfectants are regulated by the US EPA under FIFRA. We know that the US EPA requires toxicological data to support the safety of the concentrations used, and that is based on the potential residue left on food contact surfaces, and that is on food contact surfaces, not the residue that may be actually present on the final food product. The assumption here is that if it's present on the food contact surface, then it can transfer onto the product. The approach for that the EPA uses is an aggregate cumulative approach, and what they're looking for is reasonably certainty of no harm. There are tolerances that are published, and those tolerances are published and are enforced by the US FDA, okay? And they're put in practice under the US FDA Federal Drug and Cosmetic Act. And so there are specific limits that are set, not for milk, but for food in general, or mostly for drinking water. So there's a TCM limit. The CDC indicates that the level in dairy foods should be between 7 micrograms per kilogram to 1,000 micrograms per kilogram in butter, for example, is what the CDC has seen on surveys that they've done. For sulfuric acid, the FDA permits up to 30% presence in some non-protein nitrogen additives that are used to animal feed and drinking water. So this is one of the comments that I made at the beginning, that there may be intentional places where we are adding chlorinated products or residues of chlorinated products in some unintentional places, like animal feed, for example, or drinking water. However, the EPA does not provide a reference concentration because sulfuric acid is rapidly metabolized and eliminated. Then for THM, we have a limit in drinking water of 80 parts per billion. For sodium hypochlorite, actually, this is really interesting. It is exempted from the requirement to establish a residue tolerance. It's almost being grandfathered. It is considered GRAS for use in disinfection of food products by the EPA. So then the FDA allows use for sanitation of food contact articles, but it requires that the food contact articles are drained prior to contact with food, not post-rinse, just drain. The assumption here is that when you drain, you eliminate most of it. Whatever residue is left, then it doesn't pose that reasonable, it falls within the reasonable certainty of no harm. For chloride, there's a limit in drinking water, and same thing for chlorine dioxide. So this is now more on the situations, with the exception of New Zealand, that does have some specific numbers. But for example, in Latin America, so I'm saying Latin America, like if this were the European Union, no, every single country has their own agency and follows their own little rules. So there's country-specific regulation. However, this regulation is sparse and relies mostly on international regulations. Most of the places where we found regulation was from Brazil, for Anvisa, and for Chile, for the MINSA, which is the Ministerio de Salud, and for SAG, which is the Servicio Agrícola y Ganadero, so the agriculture and, losing the word in Spanish, herd, I suppose, service. There's no provisions or limits regarding the price of chlorine-based derivatives in dairy foods. There's some for water. On New Zealand, actually, the MPI, the Ministry for Primary Industries, is responsible for legislation that covers all aspects of food safety, including production, processing, transport, and retailing. Interesting, the dairy manufacturer is the risk management program operator. That's the way that it's seen in New Zealand. One thing that I should say is that the MPI, the objective is of the food safety of the MPI is to provide safe and suitable food in New Zealand, but also for export. So that's very interesting that they specifically indicate export as well. So then the dairy manufacturer that I said is the risk management program operator, and is in charge of the production of safe food in accordance with regulatory requirements. They determine on a risk basis when sampling and testing is undertaken for chlorate. And then sampling is used to verify the effectiveness of the regulatory controls. Then we also have the National Chemical Contaminants Program that monitors milk and dairy products. And then Food Safety Standards Australia, New Zealand, which is a central scientific agency, and it works binationally for safe food systems. So that was very interesting as well. As far as specific limits for New Zealand, the MRL is listed at 0.1 milligrams per kilogram. For when it's not listed, when a specific one is not listed, then it's assumed, that is 0.1 milligrams per kilogram. So there's some that are listed. So for example, chlorate, the MRL is listed at 0.2 milligrams per kilogram in milk and 0.01 milligrams per kilogram in infant formula. Anything else that is not listed, then is assumed at 0.1 milligrams per kilogram. Then Japan has an agency also, the Ministry of Health, Labor and Welfare, and it introduced a positive list system for agricultural chemicals remaining in food. But however, the regulation for chlorine-based detergents and sanitizers as it relates to residues in food products, specifically in milk, is not available in Japan. So then what do we do? Well, the first thing is there is an option to remove and there's an option to mitigate. There are two different ways to remove. There's a physical removal or an electrochemical reduction. So the physical removal, we're not destroying any of the chlorinated species. There has been some work done with water to remove, for example, perchlorate in water, but it has not been done with dairy. And milk is a very complex matrix. So many of these physical removal processes become substantially more difficult when you work with dairy. There's also a potential for electrochemical reduction, for example. So electrodialytically assisted catalytic reduction has seen an 88% percolated purge. This again also in water. They can also be a biological mediated percolate reduction using percolate reducing bacteria. So those are options. They're difficult options, they're pricey options. They're, however, mitigation steps. And this is where we want to concentrate. The first point, I suppose, to say here is that throughout our analysis, there wasn't anything that under appropriate use would be concerning. Here, the link is appropriate use. So evidently, using products as per manufacturer instructions, that includes not only dosage, but when do you use it, how do you use it, at what temperature do you use it, and also how do you store that chemical, under what conditions do you store that chemical, not using chemical, for example, that has been expired. So like I mentioned at the beginning with hypochlorous acid, with sodium hypochlorite, chlorate residues increase for the more that the sodium hypochlorite is degraded. As using sufficient rinse water when you're rinsing surfaces, limiting the reuse of rinsed water. And as I mentioned, this is a balance with sustainability measures as well. Adequate drainage after each wash cycle. And this goes back to what's one of the things that Francois was mentioning of hygienic design. And part of hygienic design is also making sure that there's tilting on our pipelines so they can drain correctly. Avoiding chlorine use for pre-milking disinfection. There are very many effective non-chlorinated based pre-dips that can be used. And I know pre-dipping is not common throughout the world, but there are many areas of the globe that do need to use pre-dipping to keep mastitis levels low. Follow correct usage doses, I mentioned that. Well ventilation of farm. Many of these products are volatile, so well ventilation of farms is important. Appropriate use. Appropriate storage of chlorinated products. Hazard measures to prevent cross-contamination. Again, back to what Francois was mentioning, there is a potential of post-contamination of products, not only when it comes to microbes, but when it comes to other contaminants like chemical contaminants. The presence and introduction of regulations is very important. They're very sparse in many areas of the world. And then the development of appropriate test methodology, so we can actually follow if there are any residues in the chain. And I believe then that is I've come to an end of the presentation. So I want to thank you again for your attention today. And if there are any questions, I don't know, Francois, I'll leave it to you.
Thank you, Carla. So first question is directly for you, Carolina, is coming from Ruben de Vries from the Netherlands. If you would consider the presence of perchlorate in milk as controllable for the dairy, at the presence of chlorate, thinking of the possibly different entry pathway. The question is about perchlorate and chlorate. Is it mitigable or not?
Is mitigable or not, perchlorate and chlorate? Yes, I think it is. I think with appropriate rinsing and appropriate storage of the solutions, it could be. I think also if we are not as reliable on bleach, is certainly an opportunity. So yeah, I do think that we can mitigate the presence of it for sure.
Thank you. So it's not a fatality.
I don't think it's a fatality. No, I don't think it's a fatality.
Aditya, are you connected? I will have one question for you if you're here.
Yeah, sure.
Yes. Yes. You were mentioning that the IDF was co-chair of the water and reuse work within the Codex. Is that something unusual, or is that quite common to have organizers, the observers, being part of being co-chair of working group?
No, it's actually very rare for an observer organization to either chair or co-lead such work. It is because IDF is specifically IDF has a sort of advisory status with Codex as well, and there was a dairy annex in this work, and so it was felt appropriate to leverage the advisory status of Codex and sort of agree to the request of IDF to become a co-chair there. So it's not usual for an observer organization to co-lead such works.
Okay. Carolina, don't go away. I have questions for everyone. It's okay.
I'm staying. I just turned off my.
You share the knowledge of platform, and you showed this example with chlorine and chloride residues. Are there other, and I know the answer, but I would like you to provide, are there other matters of concerns where this knowledge of platform with this more global approach will provide solutions, practical solutions for the dairy industry?
I'm not sure that I'm following you. What are you asking?
Other, with some of the, let's say, contaminants, are you working on this knowledge, and can you share what's coming in the pipes in terms of
yes. So PFAS, microplastics are coming in the pipeline. Other organic contaminants are coming into pipeline from so organic acids, for example. A lot of the things that we use for tea dipping is coming for us. Let me see, what else do we have that is coming? Microplastics I mentioned. Yeah, I don't have them all in my head. Any other ones that you want to add, Francois?
No. I wouldn't dare. But that's really to emphasize in terms of the theme of prepare for the unexpected. There is lots and lots of contaminants to consider, and so
maybe I should put a plug here. If you're interested on this, reach out to us. We're looking for people that will help us. We want this to be, we all have different areas of expertise, and we want this to be a all-encompassing and very a good, solid body of work. I know that I certainly appreciated all the feedback that I received throughout the revisions of this paper. So by all means, if you want to volunteer, we will take you.
So unfortunately, I got one question for me that came from the audience. Damn it. It's about a criteria or list monocytonage on infant powder and making sure that it does not making sense as such. Now, the point is behind the concept of the micro criteria. In the 2073 guidelines, they are providing a set of criteria, but it's mentioned in the document that it does not mean you need to test for every time. You need to have your own assessment, and it is defined in terms of frequency of testing if it makes sense or not. One of the usual example I take is that canned tuna is a ready-to-eat food, but no one is testing for canned tuna for Lister monocytonase because it's sterilized, so it does not make sense. That's the same point for infant powders in terms of process, in terms of potential of contamination. If everything is under control, per se, it does not make sense to test for Listeria monocytogenes in infant powders. No, does not mean it will never happen. It's never underestimate, and as said, prepare for unexpected. But as such, it's the role of the food manufacturer on a case-by-case basis to show that he made his assessment, he made his evaluation, and he can show that all the controls are in place and do not need product testing per se on the finished product. Something that was behind the implementation in HACCP some 25 years ago is to get away from finished product testing and to be more anticipative in the control measures. We are not there yet, not due to food safety experts, but due to regulatory persons who still want to see an analysis done. And that's something that we are fighting a lot, either from business to business or with distributors or with authorities. They want to see the COA, which does not necessarily make sense. It's sometimes a waste of time and money, but it's regulatory binding, ensure that the work has been done. Having said that, I would rather prefer to know that the factory is doing its work on pressing environment, mitigating all the risk, controlling the pasteurization for 80 tons per batch of milk powder, rather than coming with a sheet of paper and telling me the analysis was done. I don't say you should not test for the finished product, but I say that if you rely solely on finished product testing, at some point, you will have an issue. And if and you had comments from Ruben for other upcoming topics were metal inhibitors and mineral oils, hydrocarbons. So indeed, on volunteers are welcome. As you see, IDF is a huge community, and therefore, Aditya, it's the questions I often receive, but I let you provide the answers. Are all the 1,200 experts of the IDF employed by the IDF, or is it something different?
No, it is not. There are not all IDF employees. Of course, IDF does have 6 or 7 staff. They are experts in themselves of different topics, and they coordinate the work of IDF, also including the coordination with these 1,200 experts, which are all best of the best in their own countries, and they are associated with IDF through the national committees and proactively available for IDF work in different technical areas. So though they are not employed, they are sort of volunteers from different nations, from different regions with different expertise, and they come together for IDF work through the IDF platform. So that's the beauty of it.
Yeah. I think it's important to emphasize for people who joined today's webinar and are not familiar with the IDF, neither Carolina, Aditya, or myself are paid, employed, or received any money for the IDF. Au contraire, we spend time. Oh, the point is, it's a global community we are part of. We all start as beginners, as I did 14 years ago, and you start by learning and listening. You get a lot of empowerment for numerous experts. Some are present today, like Shoreh Farok, who is behind the work of the SCMH on Shiga toxin E. coli. Alan Saylor is working on almost everything. So it's important to have this in mind. We really welcome everyone to join, everyone bringing a piece to the cake. And it's also important to have in mind that all is possible after 120 years, thanks to a very small yet amazingly effective head office. So we just had a message from the general director. We're followed by Laurence. But it's important to have in mind that Laurence and her team, Sébastien, Annabelle, Raquel, and Aurélie, who should have been here today as well, and Maria, who is presently in Norway. They are very small, but they are very impressive in managing this community. So really a big kudos to them for this. As concluding remarks, because we need to conclude at some points, because everyone has a life after, it's important to have in mind that everything we discuss with you today is available or will be available at some point. So we have a publication section on the IDF website. Some publications are free to download, some are pay-per-view. We are not philanthropic completely. So in mind, when it comes to food safety, but more globally for the IDF committee, it will be a pleasure to welcome you this October in Paris. I know I will take the French accent of purpose. So we will have many topics discussed during Dairy for the Future in Paris. And of course, we will have a food safety conference, which is organized by Shoreh and the team of the French Dairy Federation. We will work on impact on the climate change on food safety and the One Health approach. And having said that, thank you everyone for joining today. A big thank to Aurélie for her dedication until this morning to provide all the stuff. Thank you, Annabelle, for stepping out and providing us all the logistics. Carolina and Aditya, thank you for sharing
Thank you.
It was a real pleasure. And having said that, we're wishing you everyone a very good food safety week. Having in mind that food safety is not only June 7, it's every day of the year. even weekends. Thank you, everyone, and have a great week.
Thank you. Bye-bye.
Thank you. Thanks.
Thank you.